Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Farah Affifah from Islamic University of Sultan Agung from Faculty of Medicine. I want to tell you and summarize you and explain you about some article by the title Transplantation Outcome with Donor Hearts After Circulatory Death. I want to tell you and explain you by the spice method that contain about 1, 2, 3, 4, 5, 6. There is a 6 point. The first is setting. Second is P perspective, and I that intervention, and C is comparison, and E for evaluation, and D domain. Okay. I want to tell you about the title Transplantation Outcome with Donor Hearts After Circulatory Death. That for setting, that the setting is heart transplantation involving donor hearts after circulatory death or DCD with a comparison to donor hearts from brain death or DVD, that the study takes place in a clinical trial context focused on heart transplant candidates. That from the background, that data showing the efficacy and safety of the transplantation of heart obtained from donor after circulatory death as compared with heart obtained from donor after brain death are limited. That there is a limit from for transplantation of heart. And for a perspective, yeah, the perspective is that of clinicians and research and transplant teams evaluating the safety and effectiveness of hearts from circulatory death donors. And by the method, there is a where a saying in a 3:1 ratio to receive a heart after the circulatory death of the donor of the donor of the donor or a heart from a donor after brain death if that heart was available first, and receive only a heart that had been preserved with the use of traditional cold storage after the brain death of the donor brain or brain death group. The primary endpoint was the risk-adjusted survival by the 6 months in the S-state circulatory death group as compared with the brain death group. And there is the intervention. That intervention is the transplantation of heart donate after circulatory death or DCD using a reanimation technique with extracorporeal non-ischemic perfusion. And C. Comparison, that the comparison group involves transplantation with heart donate after brain death or DVD that are preserved with traditional cold storage. And for domain, the domain is sorry, the compare comparison for C comparison, the comparison group involves transplantation with heart donate after brain death that are preserved with traditional cold storage. And evaluation, there is the study evaluates outcomes such as 6 month 6 month risk adjust survival and serious adverse event post-transplantation to determine non-inferiority of DCD hertz compared to DBD hertz. And for the domain is cardiothoracic surgery and organ transplantation, particularly focusing on donor heart utilization strategies. That the conclusion is the risk 6 months after transplantation with donor heart that had been renamed and assessed with the use of extracorporeal non-ischemic perfusion after circulatory death was not inferior to death after standard care transplantation with a donor heart. And we can summarize that the S setting there is heart transplant clinical trial using circulatory death donor heart and perspective that doctors and transplant research. Then intervention use of extracorporally perfused DCD hearts. And for comparison, that cold storage heart from brain dead donors. And for the evaluation, that 6 month survival and 30-day complication. And domain heart transplantation and transplant medicine. And from this, we know about a total of 180 patients underwent transplantation. That the 90% received a heart donate after circulatory death and 90% also received a heart donate after brain death. That a total of the body is 166 transplant recipients were included in as a treat primary analysis. And then okay guys, we can summarize that the from the article by the title transplantation outcome with donor hearts after circulatory death is identified using by the space method. That setting is in a clinical environment involving heart transplant, and also the perspective comes from medical professional and also research studying transplant safety. And the intervention is the use of hearts from circulatory death donors, and also the comparison is with traditional brain death donor heart. The evaluation is based on survival rates and serious complications. The domain also is heart transplantation and transplant medicine. Uh, okay, guys. Maybe this the the end of the my explanation from this article. And I want to thank you for watching. And Assalamualaikum warahmatullahi wabarakatuh. Thank you guys.